Individualized plans for medical needs are a requirement for any child that has any medical need, and this is outside of anaphylaxis. It does require an individualized plan to be created with families, health professionals, and all those who work with the child as well. However, it is for any other medical need, any other sort of medical device that might be required, or medical equipment that might be required to support the child to be fully enrolled and fully participating in the program. Individualized support plans are for children with special needs. Again, it is another plan to help the child be successful within the program and help staff successfully support a child in the program. It does need to be developed with families and health professionals, and it does need to include all the devices, support aids, modifications, adaptations, or anything that the child may need to be successful in the program. Nutrition, there are many records under the nutrition subtitle required under the CCEYA. A record includes infants under 1 year of age. Those infants need to have written instructions for how they are fed and what kind of food that they eat. Menus are required to be posted, and you must post the current menu as well as the next menu, and menus have to be kept for 30 calendar days. And this is to ensure that families know what their children are eating in the event that there is an allergic reaction or something of that nature. Allergy and food restriction lists need to be posted. They need to be posted in every playroom, every cooking and serving area, and all other areas children may be present. In most cases, programs bring allergy and food restrictions lists in their binder, some posted on a window on the playground, but the whole intent is that they have the allergy list anywhere they go in case they go on a walk and things like that, because you could be offered, sometimes, you offer children snack in different areas. And it should be known who has an allergy. It is also why it's required to have the full allergy list, meaning every single child in that childcare center or home childcare provider space that has an allergy or food restriction needs to be included on this list. And it can't just be for that specific room, because if children move around, like with mixed age grouping or with reduced ratio, every staff in every room should have a list that includes all the children in case that occurs during a snack time or a meal or a time of the day where everybody has to be together. There is also a requirement in terms of records to have special dietary and feeding arrangements put in writing, and this is for children that do not eat at the center or do not eat the center's food or things like that due to dietary special diet or just due to a feeding arrangement, which could also be outlined in a individualized support plan. So this written document would say that the child eats, certain foods and that that's okay, and that they've been informed not to bring any allergens into the program, and that they have been informed that the food that they bring in do not have allergens and they're of a nutritious value and follow a food guide. Program for children. The records required under this subsection is the parent handbook, the program statement, and prohibited practices. The parent handbook does need to include the program statement, and it does include prohibited practices. It also needs to include fees and admission and, discharge policies. It also needs to include information about emergency management. It has to include information about students and volunteers. And it does have to have information about the services that are provided. So whether it's a licensed childcare program that runs Monday to Friday and operates for infants to school age, or if it's a school age program, or if it's a overnight program, all this has to be outlined in the parent handbook. The program statement is the statement under section 46.3a to K that is required by every licensed childcare in Ontario to explain how the program will meet the needs of the children and families, as well as how it will maintain a program that enhances and grows as time goes on and maintains that level of communication and professionalism with the community and continuous professional learning with their staff. Prohibited practices have to be outlined to indicate what the staff are not permitted to do with children in licensed childcare. This has to be very clear to staff, and this has to be very clear to families. If any of these prohibited practices were to occur, that would be a breach of the Childcare Early Years Act, and the staff would be accountable to that, to the ministry, and there could be repercussions as it relates to serious occurrences, compliance orders, police investigations, Children's Aid Society investigations, and so on and so forth. Staff qualification. So each licensed childcare in Ontario is required to keep a health assessment and immunization for each staff member. This includes also having infant and child first aid for all staff that is attached to ratio. And these are written documents and certificates and documents that are required for qualified staff under the CCEYA. Screening measures, so every staff is required to have a police check, a vulnerable sector check to be specific, and if it is an owner licensee that operates or owns the childcare center but does not ever come on premise, they can have a criminal record check with a document that also indicates that they do not come on the premises and they will not interact with children. So you need a criminal records check or a vulnerable sector check from a police force every 5 years. In the years leading up to the 5 years, you are required to complete an offense declaration, which says you have not committed any crimes or anything like that during that year. And within the year that you require a new one, which would be your 5th year, you wouldn't be required to do an offense declaration because you would be obtaining a new vulnerable sector check. Emergency preparedness, so evacuation sites have to be documented in the emergency management policy. What to do in an emergency needs to be documented in there. Fire and safety evacuations must be posted in every room that children are present. And every room that children use that is licensed. You do need to have fire drills. It is monthly for licensed childcare centers and home childcare agencies, and it is per term for school-age programs. Emergency contact information. Every child needs to have emergency contact information in the event of an emergency, and that would include a phone number of somebody that can be contacted in the event that their primary guardians cannot be contacted. For primary guardians, their name and address in the daytime would have to be included in the emergency contact information. Under administrative matters, every licensed childcare in Ontario must have insurance. You must have children's records, which includes that includes the children's emergency contacts, their names, their birth dates, health information about them, their address, and a lot of pertinent information about the child is obtained and kept in the children's records, their immunization, if they're in childcare, if they're in school, that they wouldn't need immunization directly to be kept with the childcare center because it is a requirement for publicly funded schools to obtain in order for the child to attend school. Attendance records, so the time a child comes into the program, the time a child leaves the program, and if the child is absent, need to be documented on the attendance record daily and immediately. Not documenting this results in a non-compliance for not having accurate information as to the time of arrival or departure for a child or absence. It also is a critical risk level non-compliance. Because you do need to know the children that you do have in care, and you do need to know when they came and when they left, or if they did not come that day in the event of an emergency. Waiting list policy has to be created. It's one of the mandatory policies. It does need to include order of admissions. It does need to include how the information from families on the wait list will be kept confidential. And it does also need to include how children are enrolled in the program. So is there a priority? Is it, staff children will get first priority? Is it children that have siblings, children that come from Children's Aid Society referrals? So you have to outline in your waitlist policy how you will administer children or register children into the program. For outdoor, you do need to do daily, monthly, and annual outdoor space checks, making sure that everything is under the Canadian Standards Association. Make sure that it follows that. If you have a play structure, so a climbers, a swing, things like that, those do need to be checked annually, and those reports do need to be retained so that during inspection, ministry staff can review the outcome and results of that inspection. And daily staff and monthly staff will review the playground and make sure it's safe before children come onto the playground. If there's anything observed or any discrepancies or anything broken, such as the gate or toys, that needs to be documented and removed and repaired immediately. You do need to maintain a repair log, and all the issues and problems do need to be addressed as identified during a formal playground inspection and during the daily and monthly playground inspections. If there is no play structure, you can do your own annual inspection, but it does need to be thorough and it does need to be completed annually.